What is an H. pylori urea breath test? Have you ever wondered how doctors detect Helicobacter pylori bacteria, the common culprits behind ulcers? One of the most effective ways to do this is through an H. pylori urea breath test. This non-invasive procedure is designed to identify the presence of these bacteria in the stomach, which can lead to peptic ulcer disease. So, how does this test work? It starts with the patient providing a baseline breath sample. This is done by exhaling into a collection bag. Next, the patient drinks a solution or swallows a capsule that contains urea, often flavored with lemon or citric acid to make it more palatable. After a waiting period of about 15 to 40 minutes, the patient provides a second breath sample. The magic happens because H. pylori bacteria produce an enzyme called urease. This enzyme breaks down urea into ammonia and carbon dioxide. When the urea is broken down in the stomach, the carbon dioxide produced enters the bloodstream, travels to the lungs, and is then exhaled. If the second breath sample shows an increased level of carbon dioxide, it indicates an H. pylori infection. Preparation for the test is key to getting accurate results. Patients need to fast for about 4 to 6 hours before the test. It is also important to avoid antibiotics for at least 4 weeks prior, as well as stopping proton pump inhibitors, histamine blockers, and bismuth-containing medications 2 for weeks before testing. Other medications should only be continued if approved by a healthcare provider. The H. pylori urea breath test is safe and painless, making it suitable for most patients, including children over 3 years old and pregnant women. This test is widely recommended as a preferred non-invasive method for diagnosing H. pylori infection, especially for those showing symptoms of ulcers or gastritis. In the context of ulcers and peptic ulcer disease, this test plays a crucial role. Detecting and treating H. pylori infection can lead to healing of ulcers and help prevent complications. It guides appropriate medical management by confirming the presence of H. pylori, which informs decisions about antibiotic therapy and other treatments. If you suspect you have an ulcer or related symptoms, consulting a healthcare professional is essential. They can provide personalized advice and determine if the H. pylori urea breath test is right for you. Understanding this test can empower you to take charge of your health and seek the right treatment.